Today's guest is Dr Louise Newson, GP, menopause specialist, and well-known advocate for better hormonal healthcare. She's the founder of the Newson Health Menopause and Wellbeing Centre and the force behind the Balance app, which is helping millions of women better understand their bodies. As a neurodivergent woman and mum to ND daughters, Louise brings both clinical insight and personal experience to the table. This episode blew my mind. It opened up my mind to the impact of hormones on the brain, and I can tell you now, men, you need to hear this too. Let's get into it. Let's see how great minds think differently. So I'm sat here, Louise, thinking, I'm with someone who knows so much about something that I don't know a lot about, and that is a amazing place for me to be in.
Oh, good.
Well, obviously I'm here, hopefully our audience learning and listening, but selfishly I'm like, great, I get to like pick your brains.
Good, yeah.
And learn lots.
Yeah.
So I'm going to ask all the stupid questions. Have we always had the menopause?
We've always had menopause, yeah, in women, but not in animals, actually. It's interesting, isn't it? But yeah, it's always been there, but it hasn't been such a big problem. And that's partly, if you think back to Victorian times, most women would spend the majority of their fertile life pregnant.
Yes.
So on average, they would probably have at least 10 pregnancies, probably around 7 children. This is on average.
Okay.
But they would be breastfeeding as well. So a lot of their life between the age of 20 and 57 was the average age of the menopause then, older than now. They would have huge amounts of hormones in their body, like really high amounts, because that's what happens when people are pregnant. So they wouldn't be having a period every single month.
Yes.
Do you see what I mean?
Yes.
So that's different. But also, like now, the average age in the UK of menopause is 51, so a bit younger.
Okay.
But we live so much longer, don't we?
Yes.
You know,
Why do you think it's 6 years earlier?
Because you're resting your ovaries. You know, when you're pregnant, well, not you, but when I was pregnant for 9 months, that's 9 months without a period, isn't it? So I'm not releasing an egg.
Yes.
Whereas when I only had 3 pregnancies, but if I'd had 10 pregnancies, you know, those eggs would carry on going for longer.
So when you are pregnant, you're producing more hormones?
Huge amounts of hormones. So, and this is a rough guide, but it's about 55 times higher amount of estrogen in the body than when I'm just having a normal period.
And then when you give birth,
guess what happens?
It shoots right back down.
Absolutely, like it crashes. And that's why so many of us feel flat, low, baby blues, feeling tired, feeling joyless. We're just told it's just a bit of blues, but actually postnatal depression, of course, it's related to hormones, isn't it? So it's your estrogen, progesterone, and even testosterone, they fall off a cliff. But we're living longer, aren't we? So the average life expectancy in women is about 82 now in the UK, which is great. But that means we've got a lot longer without our hormones. And that's really important when we think about future diseases as well.
What's the most common question people ask you about hormones and menopause?
It's always about HRT.
Okay.
It's always about, will it cause breast cancer?
Is that the most common one?
Yeah, it still is now. It's the biggest fear and it's the biggest question, I think.
And give me the history on that myth.
Yeah. So it's such a shame. It's been the biggest car crash for women's health ever. If you think back in time, we knew hormones were good. Hormones are just chemical substances that our body makes from our different organs. We've got loads of hormones. They go into our bloodstream, they go into every single cell, and they help our body work. And we just so happen to have hormones that were mislabeled as sex hormones when they were discovered. So we've got.
Why was that?
Because all the experiments were done on the womb or the testis, because they knew there was something, because they knew that when women had their ovaries removed, they would get all these symptoms and it would be weird. They would be melancholic, they would be low, they would be tearful. Okay. So they're saying, there's something in the ovaries. And the same with men. They quickly discovered actually that sounds mad now, but they were using scrotum of monkeys and bull and sort of mixing it up to a tincture, so people would drink it.
No.
Yeah. Honestly, because they didn't know what hormones were, but they knew there was something in these organs.
I.e. to replace?
Yeah, but they didn't know what they were doing. So there was a really famous, very well-respected doctor called Professor Brown-Séquard, and he took this. He realised there was something in these organs, so he made this sort of mixed, drank it, and he said, I feel amazing. I've got this joie de vie. I've got this youth back. And everyone just thought he was mad. And they tried to discredit him. They said, this is awful, terrible. But other doctors were saying, no, but it's the same for us and our patients. We're giving it. We're noticing something. And sadly, when he died, people really discredited him. But then when they found out, there's testosterone in testes, but because they found testosterone in the male testes and progesterone in the female ovaries, they were labelled as sex hormones. But actually, they're not just made in the ovaries. They're made all over our body and our brains, which we'll talk about in a bit. So men have estrogen and progesterone and women have testosterone.
Do we?
Yeah.
Okay, so Yeah,
which is so interesting. So they're not sex hormone and they're not about sex. Everyone thinks testosterone is just about libido. Of course it's not. So they're not gender hormones, they're not sex, they are hormones. So
and we all have those
we all have
three.
them and we have different amounts.
Yes.
And that's really important. So that's the sort of first myth really, but I'm really interested in the history, like why are we in this mess? What's going on?
And sorry, what mess are we in?
Well, we're in this mess about this breast cancer risk. So then they started giving people hormones and women started to feel better, their well-being was better, their mood was better, their energy was better, they had less flushes and sweats. This was all sort of post-war in the 50s and 60s. But they made the HRT out of pregnant horses' urine. So that's what they were doing. It was the biggest selling drug in the US, worldwide. 40% of women were taking it who were menopausal, and they were better mentally, physically, but also studies were showing that women had stronger bones. They had less risk of dementia. They had less risk of heart disease. They had less cancers. Really important. This was in the 70s. So more and more people were going, God, this is really good. So then they thought, well, let's do a study to see if it's not just women who have just become menopausal. Let's see if older women will benefit as well, which is a good idea, isn't it? For some reason, and they wouldn't do it now, they've spent $1 billion on this study. So it was a big study, American study, but they used pregnant horses' urine tablet. And then they also used a progesterone as well, because women who have a womb, we give progesterone to. But it wasn't the natural progesterone, it was a chemically altered one, which means that it's not the same as the natural hormone.
Okay.
It won't work the same way.
It's
been altered to commercialise it. So they gave these hormones, followed these women up, and then they saw, maybe there's a slight increased incidence of breast cancer. Let's halt the study.
Okay.
Now, when you do a study, you can imagine there's lots of complicated stats, like big data sets, lots of women in the study. But they didn't analyse it properly. What they did is they just went to the media and said, HRT causes breast cancer. And they went to the medical press and said, guess what, guys? HRT causes breast cancer. So there was a big PR campaign. I mean, I've watched the videos of the day after. People are standing on their podiums and saying, big study, HRT causes breast cancer. Everyone needs to come off their HRT. This was in 2002. And of course, if you're a woman or a doctor, you'll be going, oh gosh, this is scary, this is scary. They also said there's an increased risk of heart disease as well. This is a number one killer of heart attacks. We've really got to stop. Then they analysed it properly. And they found some really interesting facts. They found that women who only had estrogen, they didn't have progesterone, so they just had the pregnant horse's urine, with time, they had a 22% lower incidence of breast cancer.
Okay.
But that didn't make the front news. It wasn't like, hey guys, we've got a treatment that reduces incidence.
So the opposite.
The opposite. But then they also found this increased risk when they added in this synthetic progestogen wasn't statistically significant.
Okay.
So it was a chance thing rather than a cause thing. But they also found that the women who took hormones of whatever type had a lower incidence of osteoporosis, thinning of the bones, really important. They had about a 40% lower incidence of bowel cancer. Now, that's really important because bowel cancer, as you know, is on the increase. They also had better well-being, better mental health. Then the risk of heart attack and clot, we know that because it's synthetic. Do you know what I mean? So they're not telling us anything we don't know.
Okay.
But the irony is, don't prescribe those hormones. So it's like comparing apples and bananas and saying all fruit is yellow.
So
do you see what I mean?
Those same hormones or those same drugs that were used in that study are now not available?
Well, I'd like to say no, but they are.
Okay.
So in America, a lot of women are still using Premarin, the pregnant horse's urine, as estrogen.
They're still using pregnant horse's urine to make estrogen pills.
Yeah, it's just the estrogen for some types of HRT, But the worst thing, I think, is that the progesterone part is called medroxyprogesterone acetate, and that is used in a lot of contraception, and it's still used in some HRT.
Okay.
So we know there are risks of clot and heart attacks. We know that it's not a natural type of hormone, but it's still used a lot.
So where are we at then in terms of repairing that damage that was done in 2002?
I think we're doing a really bad job, actually.
Oh, okay. You sort of started smiling, so I was waiting for the good news.
No, I don't think so. So if you think, like I said, 40% of women in the US who are menopausal were taking hormones around that time. About 30% of women in the UK were taking it, and it was on the increase because people could see these health benefits.
Sure.
How many people do you think are taking HRT in the UK now?
I wouldn't even like to hazard a guess.
It's about 14%. And then globally, it's about 5%.
14% of menopausal women in the UK are taking HRT?
Yeah.
Why is it so low?
Because everyone's scared because of this one study that was misreported.
23 years ago.
Yeah. It's good, isn't it? It's quite shocking. And we don't even prescribe those hormones anyway. I prescribe the exact replica. So I prescribe the estradiol, the natural estrogen that's derived from soy plants. And it's the same. The body recognises it as estradiol. The progesterone, again, is the progesterone and testosterone. Whereas the older types, they've been chemically altered, so the body doesn't recognise them, and that's why there's risks with them. Do you see what I mean?
Yeah, because it's a more foreign, quote-unquote, object.
Absolutely. And that's the same with all contraceptives have been chemically altered. Whereas the HRT that's available on the NHS, it's as cheap as chips, is the same as the hormones we produce. So we're just replacing like with like, which is what the body needs.
Where does kind of neurodiversity then come into hormones and your
so important.
work? Where
it's
does
so
that?
important.
Yeah.
So I'm very interested in the role of hormones in the brain. And I'm very interested in the brain because I don't think you'll argue with me when I say it's the most important organ we have.
Yes.
And it's the most amazing organ.
It's the most incredible thing.
It is the most incredible organ. And the more we learn about it, the more we realise we don't know much about it.
Yeah.
You know, this sounds a bit weird, but I will share it with you. My dad had a brain tumour many years ago. He died when I was 9. And the first time he had it was when I was about 3, and he had radiotherapy, had it removed. And then before he died, he had a lot of his brain taken out. And I remember being sort of 9 and him coming home, and one side of his head was just collapsed because he didn't have brain. And we had to do these jigsaw puzzles with him and try and get him to, and I was like, how do you breathe? How do you live when you've had a big amount of your brain taken out? And the brain is incredible. And I've always been very interested in what does it do? How does it work? Because I think we all think it's just about thinking, it's about memory. But when I say to people, you know what, the metabolism of your body is dictated by your brain, your heart rate, your respiratory rate. Like even when you move your little finger, it's your brain that's telling you haven't got a little brain in your finger. And it's incredible, isn't it? It's amazing.
And every single one's unique.
So with hormones that we've always been taught from the ovary, like why is it that most women who are perimenopausal or menopausal feel really low and flat and tearful? Do you know what I mean? It's not flushes and sweats that are affecting them.
Yes.
So what's going on in the brain? So the more I've read, the more I've learned. But actually our brain produces estradiol, progesterone, testosterone.
Our brain
produces them. And that's what's really fundamentally wrong in our education because most people don't realise that.
Yeah.
So your brain, I don't know if it does now, but it certainly did produce estradiol, progesterone, testosterone.
Okay.
And I'm sure you've heard, and I'm sure your listeners have heard about neurotransmitters.
Yes.
You know, these chemicals that allow the signals. But estradiol, progesterone, testosterone are neurotransmitters.
Okay, so they're bridges.
They are. And they affect the levels of the other neurotransmitters.
Okay.
And that's really important if you understand that, because then you can quite quickly think, right, so if my levels of estradiol are low, then that's going to affect my glutamate, my dopamine, my serotonin, my acetylcholine, my noradrenaline, all of those important neurotransmitters. But I think more crucially, the changing levels can trigger a myriad of reactions in the brain that can affect the way our brains function, especially if we've got ADHD.
So therefore, for perimenopausal and menopausal women who are neurodivergent, their hormone levels are at the root in terms of understanding what those levels are. Yeah, that can cause lots of traits, symptoms.
Yeah, and it's very interesting because the way our brains work, they like what's called homeostasis. You like everything the same, don't we? Our brain likes routine. Even if we don't like routine, our brain likes routine. Now, in the menopause, when people have low hormone levels and they stay low forever, it's not such an issue, actually. The brain can accommodate. It might not work quite as well. But in perimenopause, you've got these great changes of hormones. They fluctuate all the time and they can change seconds, minutes, days, and people know that because they suddenly feel really angry and then they're fine again, or they suddenly feel very tearful, or they've got palpitations that just last for a few minutes. So we know the hormones are really fluctuating. So you can imagine in the brain, you've got high, low levels. Well, what's that doing to all your other neurotransmitters? It's like, oh my God, guys, I can't keep up.
Yes.
And that's really relevant when we think not just about perimenopause, but PMS, premenstrual syndrome, PMDD, premenstrual dysphoric disorder, and postnatal depression. The poor brain is like, whoa, what's going on?
What correlation have you seen between something like PMDD and ADHD? Let's get all the acronyms in there.
Yeah, so PMDD, premenstrual dysphoric disorder, is a more severe form of PMS, premenstrual syndrome. Now, about 95% of us will have PMS, where you just feel a bit rubbish before your period. But it says only 5%. That's 1 in 20 women. A lot have PMDD. And if you think about our hormones, what happens the second half of the cycle, we have a rise of estradiol and progesterone, and then they crash just before our periods. Some women with PMDD, it's this crash of progesterone and estradiol, actually, that really can trigger a myriad of symptoms and can really affect the way the brain functions. And it's that changing hormone levels can trigger and worsen ADHD and the way people think, often with quite intrusive negative thoughts as well. We know suicide rate increases with women with PMDD. And there's, the brain is very complicated. It's not just one or two symptoms. There's a myriad of symptoms, and one can trigger one. If you're not sleeping, you're going to feel more tired, you're going to feel more irritable. So it's the whole cascade approach, really, that happens with PMDD. But a lot of people still don't believe in PMDD. A professor of general practice told me recently that it was a self-fulfilling prophecy and it wasn't a real condition.
Wow.
And I'm like, hang on, have you not spoken to women who fall off a cliff? I speak to women who can't go out for those 3 days before their periods.
And are we basically, are we terming PMS and PMDD as the same thing with different levels of severity?
Well, it's great you're asking, because it's actually, there are quite strict criteria for it if you really look it up in the textbooks, and it's, you have to have this amount and you have to have them for this amount of time, and they have to have so many symptoms and the severity. Do you know what? It's all bullshit, really, because if you're feeling bad, does it matter if it's PMS or PMDD?
Sure.
If you look at some of the guidelines, they say women should try a vitamin and exercise and eating better. And then if they still have problems, go and see a doctor. Well, hang on, it's related to changing hormones. Obviously your mood can improve if you eat a bit better, but if it's a hormonal change, but let's think about what it is. Is it the progesterone that's affecting the woman? Is it the estrogen, or is it testosterone, or is it all three? Let's get on and help them, because these women are giving up their jobs. They're not achieving what they want to. And it's not just those 3 days. Like, my daughter has PMDD, and she's fine, by the way, because she's treated. But she said to me, Mummy, the rest of the month, you're dreading those 3 days to come. Because what if they come and I'm playing in a concert, or I've got an exam, or I just want to be the best version of myself?
Yeah.
And that's what's really harrowing, and that's really happening out there. So it doesn't matter the percentage, it doesn't matter the label. What matters is the suffering to women, really.
Yes, and being able to make that better.
Yeah, absolutely.
So then what happens if you throw ADHD medication in the mix?
Well, it's interesting, isn't it? I think ADHD medication, depending on what it is, obviously can help some of those neurotransmitters and calm it down, but it's not going to treat the underlying cause. So in medicine, I've always been taught, and it's the right thing to do, is try and treat the underlying cause. So if you had vitamin D deficiency and I gave you that diagnosis, you'd probably, hopefully say to me, well, what vitamin D do I need?
Yep.
I wouldn't say to you, do you know what, I'll give you some iron as well, because that helps some people who are tired. Do you know what I mean?
Yep.
And that's the same here. I see a lot of people who have ADHD that's become really hard to manage. Life's really difficult for them. But I know that some of it's related to their hormones. So I will rebalance their hormones and then see if they need anything else, rather than say, let's give you a drug. But there's all these 3 hormones, and this is where I think the labelling of menopause, perimenopause is wrong. And like I said before we came on air, that I don't think giving people labels is always helpful, because I saw someone, for example, on Monday in my clinic. She's in her late 20s. She said, I think I've got PCOS, polycystic ovarian syndrome, but I might have PMDD, and I'm not really sure what else is going on. And it's like, well, you've got hormonal changes because you're telling me 4 days before your period, you don't want to go out the house, your mood's really low and tearful, you're arguing with your boyfriend, your skin flares out, you get acne. Then your period comes and you feel fine again. So you've got hormonal changes.
Yes.
Like, it doesn't matter what label I give you. All I'm going to do is give you some hormones to top up in those few days. So
Before
your brain
your
doesn't,
period.
so your brain doesn't have to have this, oh my God, what's going on?
Okay.
But is it progesterone? Is it estradiol, or is it testosterone? And everyone's different. But if you just
we can test. You can test
to an extent, but again, our hormone levels are changing all the time. So it's like, if I do not yours, but if I do someone's blood test and it's normal, well, it might be normal then, but 10 minutes later, it might be really low.
Yeah.
So it's often in conjunction with good clinical history as well. Testosterone is a bit easier to measure.
Okay.
But there might be some people, and I see a lot of women who are young, who are testosterone deficient, but they're still having regular periods. They feel fine because they've got enough estradiol and progesterone in their body.
Okay.
And that's where I think we should be really specific about our labelling. I am deficient of all 3 hormones, and I take all 3 hormones. But I'm sure for about 10 years, in retrospect, I was low in testosterone and didn't realise it.
How would they know if they were low in testosterone?
Yeah, it's a great question. Often knowing what the symptoms are, really. And the problem is, knowledge is really good, but if you don't have it, you don't know. A lot of symptoms of low testosterone are low mood, poor motivation, stamina being low, muscle and joint pains, headaches, worsening migraines, urinary symptoms, skin changes, but also just the inability to process in the same way. So that's where a lot of people have sort of not misdiagnosed, because they might have ADHD, but they're thinking about that first without thinking about the testosterone. And testosterone makes a big difference to men and women, actually.
Have you come across people who have either mistook ADHD for menopause, perimenopause, menopausal, or the vice versa?
Yeah, definitely.
Why does that happen?
Partly it's poor information and education, not just for the patients or the people, but from healthcare professionals as well.
Okay.
If I go and see a psychiatrist, they'll diagnose me differently than if I go and see a general physician or a gynecologist. Medicine's very siloed, isn't it? It's very compartmentalized. And I did some training a while ago with some psychiatrists, actually, about ADHD and hormones in the brain. And at the end of it, they had great questions, but they were saying, gosh, this is all the people I see. I see women in their 40s who suddenly, they think they're ADHD, go through, they've got diagnosis. And I said, well, do you ever give them hormones? No, our contract's only for amphetamine-based treatments. So that's all we give. I'm like, but then you're missing a trick then, aren't you?
But then they're also not referring anybody on.
No, they're not. And that's what really scares me. And I do think in medicine, if you give a diagnosis, you want to provide a solution, because otherwise you're just hanging there, aren't you?
Do you think hormones can help neurodivergent people?
Yeah, absolutely. And what I've learned, I've got a huge amount of clinical experience. I've learned so much from my patients the last 10 years, and I see all sorts of people from all sorts of backgrounds, all sorts of ages. And hormones make a huge difference to their brains. And I really think that menopause, perimenopause is a brain condition. It's not an ovary condition. The problem is we define it as periods. To be menopausal, you have to be a year since your last period. Like, why?
Clinically.
Yeah. But why? Who decided that? And what that means, it's all about our ovaries.
Yeah.
Yes, our ovaries don't work as well when we're menopausal, but how much sooner or later do the hormones in our brain change?
But you can become pregnant during menopause.
Yeah, some people can, especially younger women. So it's not just about fertility.
Yeah,
and then
yeah.
lots of people, I've had a hysterectomy. I'm never going to have a period. Like, does that mean I'm not menopausal? Of course, that's stupid, isn't it?
Yes.
So, but we've forgotten about our brain, and a lot of gynecologists, like, are so into the bikini area, they forget that there's a pathway. Do you know what I mean? But it's the same, like cardiologists. If you say to cardiologists, do you see many middle-aged women with palpitations? They'll go, oh yeah, all the time. Would you give them hormones? Oh no, that's not my area. That's a gynecologist's area. Really? Because the palpitations are due to their low hormones.
What do you think, therefore? I love this question. Like, I give you a magic wand. What do you do?
Oh, do you know what? I would make sure that every single healthcare professional had education in hormones and was confident in prescribing.
Okay.
Because the hormones we prescribe now are the safest thing I've ever prescribed in my medical career. And I have prescribed all sorts of drugs to all sorts of people, including methadone, including, heroin equivalent, diamorphine, all sorts of drugs. But nothing has been as effective and as safe as natural hormones. And it's transformational because it's not just people come back and say, you can mean my life back, literally sometimes save their lives. But I know that I'm improving their future health because we know, as I said, for decades that it helps their bone strength, it helps the heart, it helps the brain. So it's win-win. Like, it's maddening and really sad, actually, because women are losing out in this. Women deserve to have the best treatment for them. And it's not like out there, women are saying, you know what, I don't want hormones, actually. I'm really scared. Because I'm mobbed by people, by questions, by DMs saying, but I can't. I'm told I'm too young, I'm too old, I'm too fat, I'm too thin. I can't have hormones, that they're too dangerous. My GP's just said no. But they can get antidepressants quite easily.
Yeah, so so therefore on the flip side of that's what you would like to happen.
Yeah.
What is happening when people are going to their GP or their
the average
gynecologist?
person, will go to their GP and they'll say, I'm really low in my mood. I feel very joyless. I feel flat. My brain's all over the place. I can't sleep. I've got some palpitations. And they'll say, oh, it sounds like you're a bit depressed. Would you like some antidepressants? Or, oh, you've got 3 children. You must be really busy and that must be really hard for you. Well, it's just suddenly become hard, Yeah. So that's the problem. Or they're given some hormones, maybe, but they're like at the wrong dose, or they might just be estrogen and progesterone. And they're saying, well, I'm really low still. I'm really tired. I can't concentrate. I've got no libido. I've got muscle and joint pain. I've stopped exercising. And they go, oh, that's it. You've stopped exercising. You better go to the gym. But they're not testing their testosterone levels because they think testosterone is a male hormone and it's really dangerous.
Yeah.
So even women who are on hormones aren't always on the right dose and type. You know what I mean? If I gave you a really low dose of vitamin D and you needed a higher amount, you still have those symptoms.
And so is it the case that, and I'm being deliberately simplistic here, you can go to the NHS and get the one size fits all, and you can go privately and get something that is
Not
tailored
always,
to you?
actually.
Okay.
So what I do in my clinic is private, but I do exactly the same as I've always done as an NHS GP. The only difference is I've got longer. So I have longer appointments, so that's like a real luxury. But the end product is the same. And there are some brilliant doctors that can tailor, because it's really easy. It's really easy medicine. That's what's frustrating. So it's not that. And actually, we also see a lot of people who come from other private clinics where you're like, oh dear, what have you done here?
Okay.
Somebody got in touch with me a while ago who'd gone to another private clinic. She'd had her ovaries removed age 32 because she had a family history of cancer of the ovaries. So they removed them so she wouldn't get cancer.
Okay.
Fair play, that's fine. Then they gave her some HRT, which is good because a lot of people don't. They just say, see how you get on. So she was given a very low dose of estrogen. 3 months later, she went back to the clinic and she said, I feel awful. Like, I can't get up in the morning. I'm really tired. I'm very tearful. I can't carry on like this. I'm very joyless. And the doctor said, well, you're on HRT, so it's not that. I think you're grieving the loss of your ovaries. Go and see a psychotherapist. And she reached out to me And I went, sounds like you're not on the right dose. Maybe you need a higher dose of estrogen. You might need some progesterone. And what about some testosterone? 6 months later, she's on the right dose. She's on testosterone. She's like, wow, this is brilliant. I feel back to normal. Thank you for saving my life. So you don't always get, she spent a lot of money seeing somebody who was a professor and she thought would be great.
Yeah.
So that's why individualised medicine is so important. But it's not always you pay for it, unfortunately.
Yes.
Or fortunately. A lot of patients come to us. Patients go on the right dose and type of hormones, and then the GPs go, great, I now know what to prescribe, I can help them, and it's lifelong treatment. And then it's great because then women aren't paying in the way that they would privately.
I'm really struck by the amount of women who've been missed or misdiagnosed, let's say. The lack of, I guess, knowledge and understanding and fear-mongering on breast cancer scares and stuff around perimenopause and menopause. How many people have been missed?
It's really sad. I've just been making a word cloud, actually, of different diagnoses that have come in or different conditions since I trained as a medical student. And the thing, the personality disorders, the conversion syndrome, the fibromyalgia, all these new labels. And actually, some of them might just have them, but let's think about hormones first. And that's really important for your listeners. I'm not here, by the way, saying that no one's got ADHD, it's all hormones. I'm absolutely not. But what I am saying is that we should be looking at our hormones in our brain and we should be balancing them because it's safe, and then waiting because it can take 3 to 6 months to get, sorted properly. And then also thinking about, are there any other supplements that might help our brain? What about magnesium? What about fish oil? I'm sure you've talked about this before. All these our food. Most of us, when we don't have hormones, we feel a bit crap and we just eat just rubbish because we can't be bothered to cook. Do you know what I mean? We just reach for, I don't drink alcohol, but people do drink alcohol. Sure. They go to drugs. We did a survey, lots of people go to class A drugs because they can't get hormones. They want to get out of this cage of doom. What's that doing to their ADHD?
Wow.
So let's do basic medicine first.
Yeah.
Look at lifestyle.
Yep.
I do yoga every morning and I do a headstand every morning. That's going to help my ADHD as well as putting on a patch.
Yes.
I can't put on a patch and think it's going to do everything. But you've got to unpick it. And as doctors, I'm very holistic. I've been trained in all sorts of areas of medicine and everyone's different. If I said to someone who's got 6 children trying to get to school in the morning, oh, darling, just do some yoga every morning. That's stupid. That's not going to happen, is it? But she can do a bit of meditation before she goes to sleep, just to empty her mind.
Yes.
Do you know what I mean?
Yes.
And it's those little tools.
But why do we have
important.
this one size fits all? Why?
I think because people try to make medicine very simplistic and very tick box.
Yep.
And I think there's still a lot of power games in medicine. I am the doctor, you are the patient. I'm going to give you a prescription and you go away and take it. And that's how medicine was in the 80s and 90s when I was a medical student. We never involved our patients. And then this thing called shared decision-making came in and I was like, what? And I remember when I was training to be a GP, my trainer was lovely, John Sanders, and he said to me, Louise, you're going to be a really bad GP. And I was like, what? He said, look, you've trained in hospital medicine, you've got distinction in all your exams, you're very clever, but you will treat the patient as a disease. Because I tell you what, in medicine, in the hospital, I bet you were saying bed number 6, asthma, bed number 7, heart attack. And I was like, oh, yes, that's what we did. And I think back and I was like, gosh, I was like that in an asthma clinic I used to run, and I'd be not even saying to the patient, do you have any pets, dogs? Who looks after you? It was just, this is the asthma. I want to give them the best inhaler.
Yeah.
Rather than thinking, oh, actually, they've got rheumatoid arthritis. They can't actually pick up an inhaler. Who's going to hurt? That was where I was trained. So he really spun things for me and said, involve the patient, ask them what they want out of the consultation. I was like, John, I can't do that. I think I'm really stupid, But when I say to patients, why did you come today? What is it that's worrying you? And sometimes, you hear some amazing things. And they might say, well, I listened to this podcast about ADHD and now I'm thinking, could it be, and it's like, great, you know where they're coming from then. And that's really important because then patients feel happier with their consultation. Do you know what I mean? Whereas if I treat you and your best friend and your mate all the same, it's like, that's just
it's a more human experience.
It is. But people forget there's an art in medicine, you see. it's a science and an art. You have to know the knowledge. You have to have the evidence. You have to know the science. But the art is individualizing.
Yes.
And we've lost that art somehow.
Yes.
And I think there's a lot of guidelines, and they're a guide. They're not a tramline. They're not, we have to be working out what's right for the person. And we don't do that. And I worry even with ADHD, it's like tick, 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 tick. Yes, you've got it. Okay, tick, tick, this is the drug. Right, that's it. Off they go. Not thinking about their lifestyle, the impact. What does that label mean to them at work or at home, or, all of that? Who's picking up the pieces?
Yes.
Because I know what ADHD is. You certainly do. Lots of people don't.
Sure.
So then it's like, gosh, what does this mean?
Yeah,
and
yeah.
That's
Yeah, and there's no safe landing, or there's no support system or structure.
No.
Do we know anything about hormones and autism?
Yeah, again, it's very interesting, isn't it? So the whole autism, neurodivergent, I do see people who, a lot of women, when their hormones aren't right or they're fluctuating, become very obsessive with their thoughts. They become very ritualistic. So a lot of people who have OCD worsens, and then they ruminate a lot, they worry a lot, they obsess a lot. Then they can't sleep very well, and these thoughts really occur like early hours of the morning, and then that spills out to the day. And so then you can see those sort of traits become worse and worse.
But is this hormones or out of balance hormones accentuating?
Yeah, often it is.
Traits.
Yeah, often is. And I can say that with confidence, because often I see people, but they've also got other symptoms, and I'll say, do you know what? I don't have a crystal ball. I can't tell you whether this symptom and that is related to your hormones, but I do know that you've got some hormonal changes. So what I want to do is replace your hormones in a physiological way, wait a bit, and then see what's left. And then it might be that they've still got some anxiety, or they've still got palpitations that need seeing to, or whatever. But often you'll find that symptoms that really affected them with autism just really improve and become manageable.
Okay.
Do you see what I mean?
But are you hearing someone go, well, I was sort of managing some of the challenges.
Yeah, and then they fall off a cliff. Yeah.
Then it all has gone nuts.
Yeah. Yeah.
Is that a typical...
Yeah, and then you'll often, a lot of diagnoses in the history is talking and listening.
Yes.
Listening is really important as a doctor. But you'll say to them, what were you like when you were pregnant? And they're like, oh, do you know what? It was so easy. Like, my brain was clear. I could think, I was happy, everything. And then what about after you had the baby? Oh, no, I fell off, cliff. It was terrible. But then you say, what about your periods? Oh, yeah, just before. And sometimes when they ovulate as well, because you can get a rise and trough quite quickly of hormones, and they can feel that. Some people's brains are really sensitive to those changing hormones. So then, if they say, well, I felt like this for 2 or 3 days before my periods, but now it's like longer, but it's the same feeling. Then women are quite intuitive. You know what I mean? But you've just got to allow them, because like on paper, or when they say it, you just think, you could think, oh, that's a bit crazy. When they say, I can't think straight, and I'm really sad, and I'm arguing, and I'm this and I'm that. And some people have very, very dark thoughts. But then they said, but then I'm fine again. And if you didn't understand hormones, you think, oh, she's just a bit loopy, isn't she?
Yes.
People did. They were locked up in asylums, weren't they? So, it's, if you've got the understanding, that's why taking it back and thinking, hang on, these hormones are made in our brain for a reason. They're made because they work in our brain.
Yes.
They have a really important function. So these poor women who are trying to cope without their hormones, my car doesn't work very well if it doesn't have petrol and oil in it.
Yeah. Yeah.
We've got to think of it in very simplistic ways, really.
Can we have too much hormones?
It's very hard. Think about being pregnant. Those levels are really high in the body. We measure levels as a guide, and we keep them within the normal physiological range. So normally up to about 1,000 for estradiol, and it's about 55,000 when you're pregnant. So you can see the scale is quite
But that's
quite
not
different.
dangerous.
No. So we don't know what is best, because what I need and what someone else needs might be different. And also I measure it in my blood, What's in my blood is not what's in my brain. There have been some studies, very interesting studies from the 70s and 80s, looking at people who were sectioned in psychiatric hospitals with very bad depression. And those people needed a lot higher doses, actually, of tablets.
Okay, so they were deficient.
Yeah. They were
in
menopausal.
hormones.
No other psychiatric drug helped them. So they said, okay, let's give them higher doses. And those women did really well. But the problem is everyone's scared of hormones and they're dirt cheap. So no one funds really good studies. And they don't even really differentiate between the different hormones. So wouldn't it be great if we did some studies of progesterone in men's brains, for example?
I mean, I didn't even know I had progesterone in my brain.
No. So the first thing yours and my brain would do if we had a stroke or a head injury would be to produce more progesterone, because progesterone repairs the brain cells, improves, reduces inflammation, helps reduce damage.
So should I, as a man, be having my hormone levels checked?
The thing is, it's hard to measure like progesterone because it changes all the time.
Yes.
And your blood level isn't your brain level. But it would be very interesting to know. And progesterone is a very calming hormone.
Okay.
It helps people sleep. It helps reduce anxiety. It's got all sorts of benefits. And there are some men that have taken it, to help them sleep, whatever. And
really?
And it's very interesting. But why are we not looking at that more? It's not like with thyroxine, we give it to men and women. Testosterone we give to women as well as men. Most men will have far more estrogen in their body than any menopausal woman, but they won't realise it.
That's wild.
Yeah, I know. It's madness, isn't it?
Yeah, it really is.
But why aren't we doing more studies on hormones in the brain?
Yes.
It's so important.
Could we measure hormone levels in the brain?
It's hard because
I know
to get
change,
into the brain, you've got your spinal fluid that comes out. So you could do a lumbar puncture, but I don't know if you've ever had one. But I used to do a neurology job, and I did them a lot. And it's like, I wouldn't want one of those. But you could do brain scans. You can look at the activity.
Would that give
brain.
you a sense of if you did a brain scan of an ADHD lady who's menopausal?
Yeah, you see, it would be very interesting. There are some brain scans of people who are on hormones and seeing the activity in the brain before and after estrogen, for example. And conversely, which we haven't talked about, is women who take contraception, because it's synthetic, that chemical structure is altered, it can block the receptors. So we know that the brain doesn't work as well when they're on contraception. And there have been some studies showing the activity in the brain reduces when people are on contraception.
Wow. And what does being on contraception do to hormones?
It stops them. It gives people like a chemical menopause because it's stopping them ovulate. I know, it's double whammy.
Wow.
Yeah. So you see a lot of women, girls who are given contraception.
Do people not taking?
No, and I didn't as a doctor because I didn't join the dots because I was just like conveyor belt medicine. Women coming in with heavy periods, give her the pill. Women who maybe has migraine and can't have the combined contraception, give her the Depo, give her the implant. On she goes in her conveyor belt. And then they come back and go, I'm really tired. I put on weight. I've had urine infections. And I treat each of those things. And now I'm thinking, no, hang on. I've given them something like the injection or the implant stops ovulation. So it blocks your hormones, but also it's blocking those receptors. So it's chemically altered, having that, study, WHI study, the clot risk, the heart attack risk. That's why people have their blood pressure checked when they're on contraception, because the blood pressure can go up. We know that there's a small risk of breast cancer in women who take contraception. And even meningiomas, benign brain tumours, have been shown with some types of contraception. Because there's synthetic chemicals. Our body isn't made to have synthetic. It's like having, dare I say it, McDonald's or processed food compared to real food. It's different. It doesn't mean it's terrible, but it's not the same.
Yeah, and your body reacts differently to it.
I spoke to someone yesterday who works as a mental health nurse, and she's got somebody who's in with psychosis, and they've just changed their contraception, and it's come on since then. And the psychiatrists say, no, there's no association. We're going to give her lithium, and if that doesn't work, we'll go to ECT, electroconvulsive therapy. And this nurse is like, oh, excuse me. And they're like, no, it's nothing to do with hormones. But she said the history's so obvious. They've just literally changed. And it might or might not be, but again, in medicine, let's try and unpick it and see. And I see a lot of women who they change their contraception, they come off it, and they're like, wow, I'm back. Or they top up. So people might have an implant, but we might give them some estrogen through the skin, testosterone through the skin if it's low. And they're like, wow, gosh, all these symptoms are better.
This all sounds like so prehistoric.
It is, isn't it? I mean, that's why I spend so much of my life frustrated.
I was going to say,
because it's so obvious. Do you know what I mean?
But that's what I'm sat here thinking, and I'm only getting a 5-minute window into your world.
No, but I do. I have a lot of insight, and I'm constantly thinking, is there a study I haven't read? Is there it must be when they thought the earth was flat.
Yeah.
And I feel a bit like that. Do I live in a parallel world?
Yeah.
Are you going to suddenly produce some papers saying, Louise, you're all wrong?
Yeah.
But I can't find them. And the more I find, especially papers from the 80s and 90s before this WHI study about how hormones work. So not HRT, just hormones work. You're like, wow, it's so obvious. It's all there. But it's been ignored, and then it's been commercialised. And also don't forget the antidepressants that are available. Think of all the antipsychotics, think of all the statins, the blood pressure drugs. It's like we've got a whole...
No, we've had a boom.
Yeah, we've got loads, haven't we?
Yeah.
So why would you prescribe something that's, it's been forgotten, natural hormones?
Yeah.
And even contraception, there's so many, I don't even know all the names of them now because there's so many. But they're all synthetic, just more and more,
I'm also kind of struck, I guess, by the fact that what you're saying for women is going to be like, holy shit, music to people's ears.
Yeah.
But what you're saying for a lot of the medical community, as you've mentioned briefly with psychiatrists or gynecologists, is like, shut up, Louise.
Yeah.
Quiet.
Yeah, I know.
How do you deal with that?
Hard. It's really hard, actually, because, I feel I'm a really privileged person because I'm educated and knowledgeable. I've got a pathology degree as well, so I'm not stupid. But I'm also a woman who's really suffered with her perimenopause, and I can't get hormones from my NHS GP. And I feel like there's a lot of injustice because, I'm very fortunate. I'm white, middle class, educated. I can pay and see somebody who can prescribe for me. But
you know what to do.
I know what to do. But actually, those women that can't, that don't, and I hear them and I see them. I was doing some work in prisons last year, and I used to work in a prison. And I didn't know anything about hormones. And then I read some papers from the 1960s, so a long time ago, even before I was born, showing that women were more likely to commit a crime the days before their periods, when they're more agitated, more angry. Okay. And you can imagine, if I'm agitated and angry, I might just tell my husband where to go.
Yep.
But if I was in a different household and had a knife in my hand and my husband was very abusive, you can see where it's going.
Yep.
So when I knew all this, I thought, I want to go back to prisons and I want to listen to the women. And I just love women in prisons. I feel sad for them because they've been born into the wrong families often and they've had really bad chances in life, but they're great salt of the earth women. And I was listening to stories time and time again from women, and a couple of them I spoke to very clearly told me that they had committed a crime, then their period came and they're in for life. One of them had had a baby when she was 16, had really bad PMDD. Her mother used to come and live with her for those few days every month because they were worried about how she would look after the child. She said, one day my mum went to the shops and I just did it. And she said, now I'm in my 40s. I haven't had a period for years, but I can't get hormones. From the prison doctor, I can get antidepressants, antipsychotics, pregabalin, gabapentin. And she said, they just with my brain. I don't want these drugs. I've got dry, itchy skin. I've got urinary symptoms. I just want some hormones and they won't give them. So I'm like, what's going on? And you see them all. And, a lot of them, if you do drugs, street drugs, your body protects from getting pregnant. So often they switch off the ovaries. So a lot of women have an early menopause if they've under a lot of trauma, a lot of if they've, alcoholics, if they do drugs. A lot of them are doing drugs, aren't they? So a lot of them aren't having periods, or a lot of them are on like the depot, or they're on different contraceptives.
Yep.
So you see them all with their dry hair, their dry skin, their, everything else. And the doctors hated me going to prison. In fact, now they've banned me from going because they say it's not related to mental health and hormones, Louise. Don't you realise there's a lot of trauma in these women's lives? And it's like, yeah, of course I do. I've worked in really deprived areas. but they can also have hormones.
Yeah, why does that mean they can't have hormones?
And also, like this person who wrote in the 60s, Katrina Dalton, about people in prison committing crime, she wrote a lot about PMDD, and she was reported to the General Medical Council. They tried to strip her from her medical practice, because they said she was maverick, and she was right. And she was very insistent that women should have natural progesterone, not the synthetic.
Okay.
And she's written books about it.
This is 60 years ago.
And I've spoken to some of her patients. I spoke to one lady who, she had really awful postnatal depression and had psychosis and was very close to doing awful things to herself and her baby. She just had enough. And then she read something about Katrina Dalton and went to see her down in London. And she said, my dear, she said, you just need some progesterone. You need a high dose as a pessary through the vagina, and this will help you. And she was like, oh, anyway, she said within days, it was like light and day, the switch. And she said, she absolutely saved my life. And I said, well, what was she like as a person? Because I know that all these people, she said, oh, she was very formidable. She was tall, she was quite larger than life. And she just knew what was right. And the women knew what was right. I am insightful and I know what I'm doing is right.
I know each patient's different and you need to listen and you take the history, etc. But how quickly can you know? When
it really varies, to be honest with
you.
So often I know because of the history. So, when people say, and it's the mental health symptoms that worry me the most, because suicide rate's increasing, isn't it?
Yes.
And
it's about 1 in 10 for suicidal thoughts for menopausal women is what I read.
It's more than that, actually. Well, it depends on the group of women. In our clinic, it's 1 in 6.
Okay.
But we do see a cohort of women. But when I speak to women who've been in and out of psychiatric hospitals, and their history is very clear that they felt well when they were pregnant, they had postnatal depression, they've had PMDD, and then their mood's gone. It's not difficult to work out that some of it might be related to hormones. And the power of hormones just can't be forgotten.
It's not even about it being forgotten.
No,
it's like it needs to be known.
I know.
And let me also clear up, is the only way to rebalance your hormones to take hormones?
Yes, so that's a really good question. You cannot have a menopause labeled supplement and it's going to do it for you.
Okay.
And a lot of people, will talk about self-care. Like, I don't even understand what self-care is. Does that mean clean my teeth? I don't know. But exercise, nutrition.
Yep.
Yes, you need to eat well. Yes, you need to exercise. Our muscles do produce some hormones. So if you exercise, you might have a bit more estradiol, progesterone, testosterone in your body, but it's not going to replace it properly. Do you know what I mean? And it's
the only way to replace it properly.
To have the right hormones. And this is where I feel it's really sad, because women are just being gaslit a lot of the time. Because medicine is letting down so many women, these commercial organisations are coming in and marketing and selling. You can buy a menopause dress, you can buy menopause shampoo, but how's that going to get hormones into my body?
Can you really?
Yeah, oh yeah. You can buy face creams, all sorts, because women are desperate. But you know what?
But women are therefore in that state very vulnerable.
But I get that. When I had symptoms, my husband's breathing was annoying me. Like everything was shouting at the children. And it's quite scary. And I couldn't think. I just couldn't think. I couldn't sleep. It was horrid. And if someone said to me, do you know what, buy this hocus pocus stuff.
Sure.
It's cheaper than a divorce, isn't it?
Yes.
You go, yeah, go on, I'll try it.
So for listeners and watchers who are neurodivergent and are listening to you and thinking, oh, I wonder, I've never really thought about my hormones, or I'm having various challenges, what can they do?
I think you've got to remember that you are the best judge of yourself. Even as a doctor, and I'd like to think I'm quite a good doctor, I don't really know what it's like to be sitting in my patients. I can see what they're like, but I'm not living with them. And I feel very strongly, if anyone's suffering, even if another person isn't suffering as much with the same symptoms, if it's affecting you, you've got to get help. Because, symptoms related to ADHD, hormonal changes, it's not just having a cold that's self-limiting. It will continue and it will impact not just your life, but others. I think, and this is me coming from as a menopausal woman, not as a doctor, I think the important thing is to work it out yourself if you can. Might need to involve your partner, your friends, whatever. But so I've created Balance, which is a free app. It's always going to be free for people. It's got a symptom questionnaire that we've just recently extended. So it's got 72 symptoms on it. And it's put, brain symptoms, heart symptoms, whatever. And a lot of people like doing that because it often validates them. They often realise that their itchy skin, their jumpy legs, could be related
Itchy
to
ears.
itchy ears. Yeah, dry eyes, burning mouth, all those things. You're like, oh, right. So just have a bit of time to do the questionnaire and just reflect and think, have I always been like this, or is this new? Or does it change throughout my cycle? So this isn't just for menopause, but younger people can do this too. So that's really important. Have that knowledge about what hormones are, what they do. And then if you think, yes, it might be, then the next step, and that's the hardest step, is actually going to see someone who understands. But we can be advocates for ourselves. This shared decision making, choice, advocacy is so important. So then, if you can and you're strong enough, maybe take someone with you and say to your doctor, I'd really like to try hormones because I've read that they're safe. They might or might not help me, but I also know that they only work the day that I use them. They don't build up in the body.
Okay.
So that's really important to know as well. So if they don't work, then I'm happy to try something else. Or you can try something at the same time. There might be someone who's clinically depressed and needs antidepressants and has low mood related to their hormones. Have both. Or try one first and then the other. It's sometimes worth having testosterone levels checked because we always check them before we start, usually. Because if they're low, it just, again, you've got something to mark through. I wouldn't have blood tests in isolation because blood tests need to be interpreted in clinical context. You know what I mean? So I wouldn't say rush off and get a blood test in a local wherever because also you want the labs that are really good and, are used to doing female hormones. But then talk it through. And if someone says, no, you are depressed, no, you've got ADHD and you need this amphetamine-based drug, just say to them, well, why am I not able to try hormones? And don't be put off if you're young, if you're older. If it feels like it could be, then it probably is.
And also to clear up, you don't have to be perimenopausal or menopausal to take hormones or to be
and I think this is
deficient
really
in hormones.
important. You're absolutely. So it's a great question because so many people think they have to be menopausal. And the best time really to start hormones is certainly perimenopause because you've got this fluctuation. You want to suppress that. But increasingly, I see so many women with PMS and PMDD. So you don't have to have irregular periods. You don't have to have changing periods. You have to be thinking. And a lot of women now, especially women with endometriosis, polycystic ovarian syndrome, might be more progesterone deficient, or they might need testosterone. It's not all about estrogen.
Yes.
And that is something that I've learnt more and more. Like I couldn't have had this conversation with you 10 years ago because I would have said, oh, estrogen. But now I'm like, no, we see people with very heavy periods, with PMS, we just give them a little bit of progesterone and they're like, wow, is it legal to feel like this every day? Because I feel great. And now I've got my job and I'm promoted and I'm not having any days off sick. Like, God, you're only 22. What would it have been like if I'd left you for 20 years? And I do see those women who have been left.
Yes.
But I don't want it, I've got 3 daughters, you've got 3 daughters. I want them to have that knowledge. And my oldest daughter, who's, I'm sure, got ADHD and neurodivergent, she's also got PMDD and she uses hormones, but natural hormones. And she was saying to some of her musician friends recently, do you know what, guys? I don't even know when my period is. I feel the same every day of the month. And they're like, no, how? And she's like, Mummy, I didn't realise how common it is. And she's got some friends. She's told me recently one of her friends is on lithium. She's like, Mummy, that's got to be hormones. Like, I can't believe, why would you give someone that young?
God, I feel with having, my wife who's perimenopausal and who's on natural hormones and HRT and having 3 daughters. God, I feel so fortunate for this conversation, Louise. I feel so fortunate to be a man that feels able to be interested in this.
Great.
It's so weird to say that.
No, but do you know what? I think it's wonderful because you're just coming at it with a very open mind. You haven't been brainwashed by these studies, by this noise that's been really suppressing the conversation and damaging women's lives. So men have to be involved.
Yeah.
Because they have to advocate for others because my brain didn't function without hormones. It was really struggling to string a sentence together. So, you need to lean on others. And that's why having others involved is crucially important.
Yeah, because there's lots of parents and partners.
Yeah, of course there is.
And I would hazard a guess that a lot of the medical community is male. And this is like I'm still kind of like digesting the fact that I have estrogen in me and progesterone.
It's crazy, isn't it?
Yeah, it's really wild.
Yeah.
How ridiculous that is.
Yeah.
And do we teach any of this at schools?
No, of course not.
No, of course we don't. God, I could talk to you for a long time, but we can't. Last thing is, I'd love to give you another green badge. Louise, who would you like to give it to?
It's been on my back of my mind all podcast, because there's like most women, most people, because the awareness has got to improve, the understanding's got to improve, the stigma's got to improve with ADHD. And the work you're doing, by the way, is phenomenal, because if you haven't got understanding, you haven't got a clue, have you? I think I'd probably like to give it to my older daughter, because is it okay that she's not had a formal diagnosis?
Yeah, of course
is she still allowed? That's okay. Of
course it is.
Because she's quite kick-ass. In fact, all my children are. And they're really empowering the next generation. There are times when I'm really close to giving up my job and they won't let me. But even if I do, they're not medics, but they'll carry on. So I'd just like her to wear it with pride and start conversations.
Yeah.
So is that all right?
Yeah,
Can I do that?
absolutely. And I think that breaking the cycle, and whether it's about hormones, menopause, ADHD, neurodiversity, there is so much sort of unlearning and relearning that we need to do around the beliefs that we've sort of grown up with that are now being challenged.
Yeah.
So I've loved hearing you. I got a lot to digest. I think the impact of not knowing about hormones and a missed generation and a kind of lost section of society around females and late diagnosis for neurodivergent, like it's all part of this same. So we've got some work to do.
You have. Thank you very much.
Thanks, Louise.
For having me.
Thank you.
It's been great.